Hello friends, and in this video we will be talking about the basic fundamental concepts of general pharmacology. The video has been made on the requests of many students so that to help them get a very concise and full understanding of the subject, we will be starting with the very basic definitions. That is, we are dividing pharmacology into various branches such as the pharmacokinetics, pharmacodynamics, pharmacotherapeutics, toxicology, chemotherapy. So starting with the pharmacodynamics. Pharmacodynamics means whenever you are taking a drug, either you are taking it through IV, either you are taking it through oral route, be it any route, it will be exerting some effect on your body or on the patient's body. So effect of drug on the body of the patient will be known as the pharmacodynamics. So how I remember is D, so pharmacodynamics, drug on the body. By drug on the body I mean effect of the drug on the body. And once if a drug is doing some effect on the body, that means the body will also show some effect on the drug, isn't it? The patient's body will also show some effect on the drug, and that interaction of what a body is doing to the drug and that interaction what the patient's body or what my body is doing to the drug will be called pharmacokinetics. So pharmacokinetics will be the opposite. It will be body on the drug. Body on the drug. I have to first understand that what are the various routes of drug administration. By routes of drug administration, I mean how am I taking the drug inside my body. So after administering the drug to my body, I will be seeing both the effects, that is pharmacodynamics and also the pharmacokinetics. So the routes we will be classifying them to make it very much concise and very much simple. We will be classifying them, that what are the local routes and what are the systemic routes. So routes of drug administration. So routes of drug administration can be divided broadly into two types. Either it can be a local route or it can be a systemic route. Local route, as the name itself suggests, local means we are doing something, we are putting the drug at some local site. It can be skin, it can be a mucous membrane, it can be in the intrathecal area, it can be in the intra-articular area. But in case of systemic route of administration, we are administering the drug which is directly going into my systemic circulation. So first we would look into the local. So local can be further divided into three. Local routes can be of three types. Broadly, we are broadly classifying them. That is, first one is the topical route. Topical route means when you are administering a drug to skin or it can be mucous membranes. Second route can be intra-articular route. Intra-articular route means I am administering the drug directly between the joints. So the joints which are articulated, as you know from your basics of anatomy, that you have a male part and a female part in a joint, isn't it? For example, in case of a knee joint, you have a male part which is articulating. For example, the male part here is the femur and the female part is the tibia. So if you are putting a hydrocortisone injection here, for example a hydrocortisone is an anti-inflammatory drug. So hydrocortisone injection, if you are administering in between the joints where they are articulating, we will be saying this method of administration is intraarticular, as simple as that. Third route I can say is intrathecal route. What is intrathecal route? Intrathecal route means, for example, when you are administering your drug inside the subarachnoid space. Best example I can give is amphotericin B, an antifungal agent. So amphotericin B. So Roker routes I can further divide into topical route, intraarticular route, intrathecal route. Topical means when I am administering the drug directly to the skin or to the mucous membranes. Intraarticular means I am putting the drug in between the joints. For example, a hydrocortisone injection to decrease the inflammation. For intrathecal route, I can give a drug, for example, the amphotericin B. So what about the systemic routes then? Systemic routes I can broadly categorize them under two, that is antral route. That is antral route and parenteral route. So antral route means antral itself stands for the GIT. So I am administering the drug in my gastrointestinal tract, and we know we have two major sites by which we can administer through the GIT, that is the oral route or the rectal route. Oral route or the rectal route. So oral routes, we are every day we take some medicines through the oral route, and the benefit of the oral route is it is very much safe, and it has a financial aspect, that it is economical. But it's not that every drug will be administered through the oral route. We will be discussing in our further discussions about the first pass metabolism. There are some drugs which have the highest first pass metabolism. For example, we have nitrates, we have lignocaine, we have propranolol. So these have the highest first pass metabolism, and you can't take them through the oral route because they will be highly metabolized by the liver, and the metabolites will not be able to produce their desired effect. So for rectal route, I can give the examples such as we are giving the diazepam. A diazepam is a benzodiazepine given in children with febrile seizures. So in patients with pediatric patients for febrile seizures, we give diazepam, and febrile seizure patient we administer this drug through the rectal route. Discussing about the parenteral route, let us make it separately. So parenteral route we can have, it can be IV route, it can be IM, intramuscular route, it can be subcutaneous, it can be sublingual, it can be transdermal, or it can be nasal, and also it can be inhalational. So let us talk about the injectables first. So injectable parenteral routes. So injectable parenteral routes. So first thing we have intravenous, and intravenous, the angle at which we are administering the intravenous dose is 25 degrees. So intravenous injection is done at 25 degrees, and we are directly putting the drug in between the epidermis and dermis. In between the epidermis and dermis, we have a vein, and we are administering through the intravenous at 25 degrees. So we incline our syringe at 25 degrees. The beauty of this procedure is that this way of intravenous will help me give the effect very much swiftly. That means I can use the IV method in emergencies. Since I am directly able to administer the drug, and also we will be further reading in further discussions that intravenous route is having 100% bioavailability. So since it is having 100% bioavailability, it will give me a full effect. I will get a full effect of the drug. In the intramuscular route of administration, we are directly injecting our drug deep inside the muscles. So we go in depth into the muscles, and we know if you want to reach the full depth of the muscle, because from your concept of anatomy, you know, first we have epidermis, then we have dermis, and after that we have subcutaneous tissue and also the muscular. So muscular is present at the extreme end. So this is your epidermis from above, which you can see, and while going downwards at the end you see the muscle. So you have to pierce all these layers to reach the muscle, isn't it? You have to reach all the layers to pierce the muscle. So the angle should be 90 degrees. So your syringe should be inclined 90 degrees to the plane of the site of administration. So IMs are given at 90 degrees perpendicularly. Subcutaneous route is a very nice method. If you want a convenient method, it is convenient because you can yourself administer the drug. You may have seen some people after eating the food, they take insulin injections by this. So subcutaneous route example you can think is insulin. By 45 degrees I mean this is the skin surface and you are giving the injection 45 degrees and reaching the subcutaneous tissue where you have more amount of fat and adipose tissue. Next injectable route is intradermal route. In the intradermal route of drug administration, we administer the drug at an angle of 10 to 15 degrees. At an angle of 10 to 15 degrees to the skin, and you will see a characteristic elevation known as bleb. So bleb formation is seen in intradermal route of injection. For example, you are going for a tuberculosis vaccination, for example the BCG vaccination, or for example your doctor has prescribed you are a patient, you have an infection and the doctor has prescribed you a penicillin, for example amoxicillin, and amoxicillin is to be given intravenously. So first the pharmacist or the nurse will do a test dose. So test dose, she will inject this drug intradermally at a local site of your skin, and then she will see whether there is any sort of change or any sort of rashes or any sort of pruritus associated with the drug. If the same is seen or the same is verified, the drug is not administered systemically but an alternative remedy is prescribed, that is, it can be any cephalosporin. So intradermal route is a very nice method to test the drug allergy or if you are going for a BCG vaccination. Next we come to the non-injectable route. So transdermal route is that route, transdermal route is preferred only for those drugs which have a high lipid solubility. So transdermal route we go for highly lipid soluble drugs. So the concept for transdermal route, this concept of transdermal route has been used in the transdermal patch. So you have come across transdermal patches in the market. For example, we have transdermal patches of nitroglycerin, we have transdermal patches of nicotine, we have transdermal patches of hyoscine. So what is the principle behind this patch is these drugs are highly lipid soluble and they can be absorbed through the intact skin. So once you are placing them on your intact skin, these drugs will be released at constant. There will be a constant release of these drugs. By constant release of the drug, I mean that the patch should deliver the drug less than the absorptive capacity of the skin. That means if my absorptive capacity of skin is more, the rate of drug delivery should be less. So it is helping me, this method, this concept is helping me to administer the drug into the blood constantly. I won't get low levels of drug in the blood, but I will be having a constant level of drug in the blood, and this principle have been used in transdermal patches. There are many examples of the transdermal route, the drugs which are given transdermally, but I am writing some few examples here for your understanding. So which drugs are given by nasal route? Let us write some drugs. Which drugs are given by nasal route? So drugs which are given by nasal route are neferelin. We know neferelin is a gonadotrophin releasing hormone agonist. So in the nasal route, the drugs which are given through the nasal route include gonadotrophin releasing agonist, that is the neferelin, or we give the desmopressin. Third route is the inhalational route. So the inhalational route, the drug can be controlled. Like when you are taking, for example, if you are on an IV infusion, you have an IV line connected to your venous system, and you can control the rate of drug delivery from the external, from the outside, outside you can control the IV infusion. The rate of drug which should be delivered to your body, you can control it externally. So same in the inhalational route, I can control the rate of drug delivery. So IV infusion is equal to inhalational route. But the difference is, in the IV infusion is an injectable route, inhalational route is a non-injectable route. The difference lies only the way they are administered, but it's the same mechanism like we are doing in the IV infusion, in the intravenous infusion, where we are controlling the rate of drug delivery, and here also we can control the rate of drug delivery. So the drugs which are administered through the inhalational route are, for example, we have salbutamol. It is a bronchodilator and a beta 2 agonist, which we will be reading in the ANS pharmacology. So we have many beta 2 agonists like the salbutamol, terbutaline, albuterol, salmeterol, formoterol, many big list of them. Second, we have ipratropium. It is also given through the inhalational route. Chromoglycate. These are the drugs which are given, which can be controlled externally, as we have seen in the IV infusion, And also your inhalational anesthetics. We use inhalational anesthetics like nitrous oxide. So that is also, the route is known as inhalational route. Next route to describe is sublingual route. So in the sublingual route, in the terms lingua means tongue and sub means below the tongue. So we are giving the drugs, we are keeping the drugs, we are administering the drugs beneath the tongue, lingual vasculature. It is the lingual vasculature out there. So what is the benefit of the lingual vasculature? Lingual vasculature is giving me a bypass. It is bypassing the liver, because we know from our concepts of physiology that whenever we are taking something orally, that would not directly end into the right atrium. That won't get directly into the right atrium, but it will first, after absorbing, it will go through the hepatic portal system. The liver will modify the thing, the liver will modify the drug, and then it will be coming out through the hepatic vein and into the vena cava system. So the beauty of this route is, we are bypassing the liver and my drug will be directly the form in which I had given the drug, it will be having the same bioavailability. So I will be getting the I will be directly using it in the emergencies. So that means if I am putting it beneath the tongue, that means I can also control the drug. I can spit it. Once I am getting the desired action, I will spit the drug. The amount of drug which I want the desired effect, that much I will be accepting, and only the remaining thing I will be spitting out. So it is a very nice method to get the desired action of the drug. So it is also used in the emergencies. And another nice thing about this route is you can self-administer this drug. You can self-administer this drug. And you don't need any medical professional or a healthcare professional to give you this drug. So which drugs are given by sublingual route? Let us write some examples. We have nitroglycerin, we have clonidine, we have nifedipine, and many more. So you can give these drugs by sublingual route. In the next video, we will be talking about the pharmacokinetics and pharmacodynamics. So if you have not subscribed to my channel, please subscribe to my channel Chambers and watch more videos like these. Thank you.